Understanding anxiety, an introduction. Anxiety is a common human experience. It's a feeling of worry, nervousness, or unease. We all feel anxious at times. It can even be helpful in certain situations, like when it motivates us to study for an exam or prepare for a presentation. However, when anxiety is persistent and overwhelming, it can interfere with our daily lives. This is when it crosses the line into an anxiety disorder. Anxiety disorders are the most common mental illness in the United States. They affect about 40 million adults each year. That's almost 1 in 5 people. Anxiety disorders are highly treatable, yet only about 37% of those suffering receive treatment. The good news is that with proper diagnosis and treatment, most people with anxiety disorders can lead full and productive lives. This essay aims to shed light on anxiety disorders, their types, causes, and most importantly, the available treatment options that can pave the way for recovery. The chemistry of anxiety neurotransmitters at play. Our brains rely on a complex network of chemical messengers called neurotransmitters. These messengers play a crucial role in regulating mood, emotions, and behavior. When it comes to anxiety, several key neurotransmitters are involved, including serotonin, dopamine, norepinephrine, and GABA, or gamma-aminobutyric acid. Serotonin is often referred to as the feel-good neurotransmitter. It helps regulate mood, sleep, and appetite. Low levels of serotonin have been linked to anxiety and depression. Dopamine is associated with pleasure, reward, and motivation. Imbalances in dopamine levels can contribute to anxiety, particularly in social situations. Norepinephrine is involved in the body's stress response, commonly known as the fight-or-flight response. When we perceive danger, norepinephrine levels surge, leading to physical symptoms like a racing heart, rapid breathing, and sweating. In anxiety disorders, this response can be triggered even in non-threatening situations. Finally, GABA acts as a calming agent in the brain, inhibiting excessive neuronal activity. Low levels of GABA can contribute to feelings of anxiety and restlessness. Decoding anxiety. Types and their telltale signs. Anxiety disorders are not one-size-fits-all. They manifest in different forms, each with its unique set of symptoms. Understanding these distinctions is crucial for accurate diagnosis and effective treatment. Let's delve into some of the most common types of anxiety disorders. Generalized anxiety disorder, or GAD, is characterized by excessive and persistent worry about everyday things. People with GAD often anticipate the worst and find it difficult to control their anxiety. Physical symptoms include fatigue, muscle tension, irritability, and difficulty sleeping. Panic disorder. Individuals with panic disorder experience recurring panic attacks. These are sudden episodes of intense fear accompanied by physical symptoms such as a racing heart, chest pain, dizziness, shortness of breath, and a sense of impending doom. The unpredictable nature of panic attacks can lead to avoidance behaviors as individuals try to prevent future episodes. Social anxiety disorder, or SAD, also known as social phobia, involves intense fear and anxiety in social situations. People with SAD worry about being judged, embarrassed, or humiliated. They may avoid social gatherings, public speaking, or even eating in front of others. Post-traumatic stress disorder, or PTSD, can develop after experiencing or witnessing a traumatic event such as a natural disaster, accident, violence, or war. Symptoms include intrusive memories, nightmares, flashbacks, avoidance of reminders of the trauma, negative thoughts and feelings, and heightened arousal, like being easily startled. Obsessive-compulsive disorder, or OCD, is characterized by unwanted and intrusive thoughts, known as obsessions, and repetitive behaviors or mental acts, known as compulsions, that individuals feel driven to perform to reduce anxiety. Common obsessions include fear of contamination, unwanted thoughts, and a need for symmetry. Compulsions can include excessive hand-washing, counting, checking, and arranging. Specific phobias. These involve intense and irrational fears of specific objects or situations, such as spiders, heights, flying, or injections. People with phobias often go to great lengths to avoid their triggers, which can significantly impact their lives. Obsessions versus compulsions, untangling the knot. In the realm of anxiety disorders, obsessive-compulsive disorder, or OCD, often stands out due to its unique symptom pattern, obsessions and compulsions. Understanding the difference between these two is crucial for unraveling the complexities of OCD. Obsessions are intrusive, unwanted, and persistent thoughts, images, or urges that trigger anxiety and distress. These thoughts are often unwelcome and inconsistent with the individual's values and beliefs. Imagine constantly picturing yourself harming a loved one despite having no desire to do so. These distressing thoughts are a hallmark of obsessions. Compulsions, on the other hand, are repetitive behaviors or mental acts that individuals feel driven to perform in response to obsessions. These behaviors are an attempt to reduce anxiety or prevent a feared outcome. However, the relief is usually temporary, and the cycle often repeats itself. A common example is excessive hand-washing in response to a fear of contamination. The relationship between obsessions and compulsions is often cyclical. Obsessions trigger anxiety, which fuels the urge to perform compulsions. While compulsions provide temporary relief, they ultimately reinforce the cycle by strengthening the link between obsessions and anxiety.